Live from Liquid Studio Group, it's 3 Men and a Mic with your host, Joe Barron, Gene Belmares, and the Honorable Javier Montemayor, our closer. 3 minds, 1 mic, 0 filter. Sit back, relax, and enjoy. 3 Men and a Mic starts now.
And we're live from Liquid Studios, 3 Men and a Mic, with my host, Joe Barron, Javier Montemayor, and yours truly, Gene Belmares, and our guest who's joining us on scene right now, Baldo Granados, who will be here to talk about healthcare, as that's our hot topic for today. But we wanted to welcome you all to our first live show. We still have a few kinks working out here. We're hoping that all of you that are watching online on YouTube, our YouTube channel has it live at the moment. I think you can find that link on Facebook as well to get to it. We're going to have a live call-in. You'll see the number come in the bottom there, or you can call in and ask a question somewhere in the middle of the show. And we'll also be reading some of the comments coming in through YouTube online, so we can kind of give you guys a response to some of the questions you might have. Guys, what a week.
Hey.
Right?
What a week. It's spring break, you know. I'm glad I hope everyone is enjoying their time off. It's, you know, it's well deserved. All our teachers and all our administrative staff, our students, you know, the beaches are full, the vacation places are all full and stuff, and so it's an interesting topic. You know, I'm glad Mr. Granados is here with us this afternoon, and the availability of healthcare, the quality of healthcare, and all those topics are really buzzing all the time, and the community's always got questions as to why and what and how, and so you know, it's good to have you here.
Thank you. Joe, in the second half of this, we're going to have Dr. Martin Martinez come on as well. He's a double board certified pain management anesthesiologist, and I know you just had a healthcare.
We had a little bit of an experience at one of our local hospitals.
So we'll be talking about that.
We'll be talking about that. You know, one of the questions is that everybody asks, why do you go to San Antonio, right?
Yeah, that's a good question.
Yesterday was a prime example of why. So we'll touch it.
So last week we had elections.
Yeah.
We saw that for the state and obviously the county. What are your thoughts on the elections, guys?
I'm happy. You know, I think there was a good. You know, it started off slow. I think the voter turnout came out to be about 30%, maybe 35%, combined Republican and Democrat. We had about a little over 20,000 voters come out, if I'm not mistaken. It's going to be interesting in November. I know we're going to have some city council races, school board races. The Democrats and Republicans are going to square off. There's going to be a lot of congressional races that are going to be very key in how the House and the Senate are going to be run after November. You know, so I think it's going to be very important. I think it's going to be very important for people to come out and vote. You know, I encourage people to come out and vote, but I like the way I like the turnout. You know, I think it was the voters were very clear. We still have the county judge race coming up.
That's right.
I just think that the runoff is just too far down the line. You know, May 28th.
90 days.
Yeah,
I mean, 45 would have been a good number, right?
Yeah, you know, just right away. You know, 2 weeks later, move it down a month later. You know, it's more money, more time. Voters tend to disappear, and it's a lower voter turnout. But
that decision's state driven, is it not?
Oh,
yeah.
It
So
is.
driven by the state. I really don't understand why they would want to push 90 days out. 45 days just seems like the better mark, right?
And I know that you may disagree, but I think the Democrats really have a solid chance at taking some key seats this time. And so statewide, you know. U.S. House, I think we have.
I've got an interesting take on it. Yeah, because
we've talked a little bit,
right?
and some of the numbers that you gave me were
pretty interesting,
right?
Right?
Pointing at a different direction. Yeah, absolutely.
So I was telling Joe the last time that we had an election 2 years ago in that cycle. In the primary, what I look at is I take off my Republican hat, and I take off my political hat and put on a statistician's hat. And I just look at numbers. I just want to see how many people cast a ballot in the primaries for both parties. And I look at the top two races. In 24, it was obviously the president's race and also the senator's race. Senator Cruz and Colin Allred on the Democrat side. In the Colin Allred race, he garnered about 920,000 votes, and the also-rans got about another 60 or 70. So he was right under 1 million total votes cast in the Democrat primary. Cruz, on the other hand, had 2.2 million cast. At that point, I knew that there was no way that the Republicans were going to lose the seat, although Ted Cruz used it to fundraise magnificently. In this cycle, what I saw was something different. In that race between Crockett and Tallarico, and the governor's race, Abbott and Gina Hinojosa on the Democrat side, the Democrats pull in 2.2 and the Republicans pull in 2.1. So the Republicans didn't lose any votes per se, but there was a lot of people who didn't come out the last time, didn't come out in the 2024 general election, that came out for this particular primary. What drove that? I don't know. That's and that one race in Fort Worth, the state senate. When I saw it originally in that special election, there were two Republicans who ran against the Democrat. They garnered about 60,000 votes combined, but neither one of them could break 50. Right. And the other guy, Remitt, came into that runoff one-on-one with the second candidate, which is a Republican. And in that particular race, it was 44,000 to their 38,000. He wins. Well, thinking, okay, it's a fluke, it's a special election. The Republicans didn't come out. This time, 44 and 42. One was running on the Republican unopposed, the other was running on the Democrat unopposed. 44 for the Democrats, 42 for the Republicans. So the numbers bared it out that he had a solid win. So that spells trouble for the Republicans, in my opinion, if they don't do their homework, don't do their work.
So you got Tallarico now facing off against John Cornyn.
Or Paxson, whichever.
Well, Paxson apparently bowed out. If social media is, if anything's true about social media, he was asked to bow out, and so. But that's going to be an interesting race.
Trump hasn't made an endorsement yet, and the trade was, I'll bow out if Cornyn agrees to break the filibuster and do the SAVE Act.
Sure.
Which I don't think has happened. So, as far as we know, there's still a runoff coming in here in May, and there's a couple other races on the Republican side that are going to be runoff in here in May as well. And of course, here locally, we have the county judge's race, which is an interesting race.
A
lot of money has been poured into that race on both sides. Obviously, there's a pack out there, but the rest of the races came out about where we thought they were. Chuy Dominguez held his ground and was able to defeat Joaquin Rodriguez. Esteban Rangel, even though he had some legal issues at the tail end of it, crossed the finish line by 150 votes.
That's why every vote counts.
Every vote counts, right? And there is going to be a Republican opponent to him in November. So will that continue to affect him in that particular race? We'll have to see. Right, but interesting stuff. We're going to take a quick commercial break and be right back with our guest, Pablo Granados, as we talk healthcare.
Life is full of great moments, special moments, shared with friends, family, and loved ones. But for some, pain deprives us from fully enjoying these moments. If chronic pain is keeping you from fully enjoying life, there is hope. Hi, I'm Dr. Marta Martinez. At Advanced Spine Pain Solutions, we're dedicated to treating our patients with the most advanced and compassionate care possible. Visit us for an evaluation and let our experienced staff help you get back to living a pain-free life.
Mike, healthcare with Pablo Granados, Farmers Insurance agent, but he sells other policies as well, correct?
Yes, correct. We have some other carriers. And then with the healthcare, we do carry the ACA,
The ACA
marketplace.
the Affordable Care Act,
The Affordable Care Act.
affectionionately known as Obamacare for some.
Obamacare, yes.
Yeah,
Affectionately.
the unaffordable. I like to refer to it as the Unaffordable Care Act because I mean, again, I have my issues with it in terms of affordability.
Right.
But I had some good questions. I know we all have had some medical experience in Laredo on the provider side, but we also have had issues with our insurances. I know right now the school district is dealing with their policies and premiums that are paid by the district, the contribution that they make, and then obviously what the employee pays.
Yeah.
But Joe, I mean, at the NGOs, you guys, nonprofits have to kind of bundle a place to aggregate somewhere to get insurance. But one of my questions is why is the Affordable Care Act so unaffordable?
So a lot of it is based on a rate scale, like a sliding scale, right? So it's based on how much you're making. So really the ones that get impacted the most are going to be your self-employed people, and then people who have pre-existing conditions. So in those situations, they're looking for somewhere to go. Obviously they can't get it either where they work, or it's a small business and they're not getting it that way, or they need to, or they have their own business and they need insurance. So based on the sliding scale, when you're, so if you take an example, somebody making 30,000, well, they're going to get the subsidy from the government, right? So sometimes they'll pay nothing. So, and then it starts to jump, right? So every $10,000-$20,000, you're starting to see the jump. And then you get to the point where like you're making 68,000, 70,000, there's no subsidy, and now you're paying the full amount, right?
Right.
And then, go ahead.
No, I'm listening.
So that's what makes it kind of unaffordable. But at the same time, what's the alternative? You need to get some health care, right? And so it does have some benefits with the Obamacare.
But do you think you go to a hospital, right? I don't know the prices, right? But they give you an aspirin, it's $400.
Right.
Does that kind of drive the cost
Well,
of
so
all
there-
this also, or does all of that have an impact?
So when you're talking about like drug prices, a lot of it is negotiated, right, with the insurance companies. And so like when we talked about a little bit, and I know you might talk about it in the next segment, but when you talk about going to, you said like the hospital, right? So when you go to the hospital, a lot of times everything is a little overpriced. Why? Because if you go in, say you have a cut in your hand, they're going to go in, they're going to give you a stitch, but then all of a sudden you start getting chest pains and you're having a heart attack. Well, everything is there, right there at the hospital to take care of all your needs. So really, they're pricing things in a sense to cover the costs that they are to provide a one-stop shop.
Okay. Let me ask, and I'm curious. I taught at the university, for many years, and one of the things that we talked about, was in one of the courses I taught was how insurance rates, are very, they set them by the area or by the region, for example.
Oh, yeah.
Let's say the Hispanic culture or the Hispanic population in South Texas.
Right.
A lot of high, heart disease, a lot
Diabetics.
of diabetics, high sugar,
Yeah.
and so they're going to set the rates there, starting off at a high rate.
Right.
Is there anything that you could tell us that, hey, we need to work on this or we need to work on that? Better exercise, better diet.
Well, and,
to help
and
bring
that's
those
that's the
rates.
whole thing. So with the ACA, they have the ability to have some pre-screenings that are at no copays. So you get that. So you want to have preventative care, and you want to make sure there's when you find a doctor, make sure that they're providing you not only the medication but also like it's a lifestyle change. And like my background before, I worked at the health department like in 1989, and so I worked at the diabetic clinic. So I saw a lot of those patients, and a lot of those patients were some of my dad's friends that come in, and so you start seeing that it's a little bit cultural, of how our diet is, and but yes, to your point, if we're more proactive in doing the exercising, that can better the health, and not only that, but it could drive down some of the premiums.
As a whole.
As a whole.
In the old days, though, before the Affordable Care Act, if you had a pre-existing condition, you went into a risk pool, a high-risk pool.
Yes.
You could still get insurance, but the rates were astronomical, and then also your lifetime maximums were capped, and you also your out-of-pockets were higher, and then your deductibles were much higher. But even now with the Affordable Care Act, the deductibles in a lot of cases are just unattainable. I mean, if you really have to put a lot of your own money into your own
Right.
treatment
Like
before it kicks in 100%.
Right. So I can give you an example. Like there's a plan that we do sell, and some of them have like a $2,500 deductible, but then like out of pocket would be like $8,000. So you have to hit the $8,000 before they cover 100% of everything. But if you hit the 2,500 mark or the 1,500 mark, depending on the plan, then it's
80-20.
80-20.
80-20.
Well, it depends on the tiers, right? They have the bronze, the silver,
Platinum.
Gold,
and
right.
platinum, right?
Yeah.
And so that's how you break it up, right?
Interesting.
Is one of the challenges of the Affordable Care Act the fact that they give the premiums, the subsidies, instead of giving them to the individual, they give them to the insurance companies. And so the insurance company knows how much money they're going to get, and they say, well, you know what? Why not just raise the prices X for the premium, knowing that the government's going to cover that portion of it? And so in those first 6 years, the premiums just skyrocketed.
Right.
They went from, relatively affordable, and the subsidies were affordable for the taxpayer, but now they've gone to a point where the insurance companies who are now receiving the benefit directly or just keep raising. The more they ask, the more they get.
Right.
And so, would it change any if we gave it to the individual, you think?
Well, if they give it to an individual, it gives them more options, right? And so maybe that would make more competition within the healthcare industry, the insurance companies, and that could potentially drive it down. But
Is there a possibility that I mean, again, we're dealing with a lot of fraud right now in the
Right.
country, different places, that the person receiving that benefit would never buy the insurance?
And I think that's one of the things that can come out of it, right?
Right.
So, I run into clients that struggle, to pay their monthly premiums to be able to continue even though they need it.
Right.
And so you run that risk. I would imagine, time would tell, right, if to test it out and see how it would work.
Got it.
What are some of the good things that came out of the Affordable Care Act?
So the Affordable Care Act, obviously the pre-existing conditions, so you'll have some coverage. A child can stay on as 26 years old with their family, right? The plan. Then it has the preventative care, your lab works, all that, which has no copay.
Got it. And then there used to be a lifetime maximum. So you've got cancer, for example, and your treatment exhausted. I mean, you went all the way to $2 million. At that point, that's it. The insurance
Right.
would either drop you or just wouldn't pay anymore because you were capped out. With the Affordable Care Act, I think one of the good benefits was
yes.
that there's no
There's
more
no-
lifetime maximums.
Right.
You continue, you're sick, you get the treatment you need.
Right.
Which is going to bring us to an interesting question that we have for our next guest about that, treating for outcomes versus just treating for the sake of treating.
Right.
We have that concern. I know that's one of them. And insurance companies, Joe just had an experience recently where they're trying to get him out of the hospital as soon as possible because they want the bed for somebody else, or in this case, I think they're asking Joe to self-diagnose.
Right.
Yeah.
Is that what it was?
That's what it was. Yeah.
You tell the doc, hey doc, I can't chat GPT this,
Yeah.
I-
Well, we can.
Oh, yeah,
Yeah, but
You
you're not
probably
going to get
can.
discharged based
But
on
yeah.
that.
Yeah.
Let me ask you a question. One of the things I run into, because I've gone on the marketplace for many years. I've run my law firm, and for years I've been purchasing health insurance, HMO versus PPO, and it was always you go to some of these doctors and we don't take HMOs. We only accept PPOs.
The networks.
What in the easiest
Layman's
way,
terms.
yeah, layman's terms.
Simple terms.
What do you tell somebody? Well, this is the difference between an HMO and a
So
PPO.
the HMO, you have to be in network, right? So that it gives you better coverage if you're in network. They call it the EPO within the marketplace, but it's essentially the PPO.
The PPO.
So the PPO, you can go to doctors that are not probably in the network. So you have a little bit more flexibility in who you go with. Me, when I was working in corporate America, I would always get the PPO. Why? Because I tend to travel with, and then my kids, and you never know. Your kid falls and has to go to the hospital, and you want something that'll cover.
Yeah.
So, it has its benefits, right?
I run into that for a long time, and a lot of doctors don't accept the HMOs. They accept the PPOs, and it's always been a battle. And getting a hold of insurance companies is very difficult sometimes to go through all the phone calls and the red
Yes,
tape.
the red tape.
And the red tape.
So that's the one thing I explain. So when they come into the office, the first thing I say, okay, I'm gonna need a list of your medications, list of your doctors. So then I start doing a search to make sure everything is covered with the plans that I'm looking at. Then you start looking at, what do you want to pay? Because in some they have the bronze, the silver. So like the bronze is 60-40, right? You pay 40, they pay 60 until you get to your out of pocket. And then platinum, I think, is like 80-20, something like that. But of course, it's like anything. Like with I equate it to a car insurance, right? The comp collision, higher
deductibles.
liabilities, all these things. It's
Gap
gonna drive,
insurance, everything else you're on
it's
top
gonna
of that.
drive your insurance prices up. But are you better covered? Of course. Same thing with the insurance. You have the bronze, and then you progress up to the platinum. Platinum, you have more coverage, but of course your premium is going to be higher. Sure. So it depends on what your need is.
I've never assessed the coverage, the healthcare coverage of our local community, but if you had to put a percentage, how much of our community is actually covered, do you think, in healthcare?
I think it's a very low percentage.
Really?
Hmm.
Really?
Because if you really think about it, when I see people coming into my office, they're struggling to even pay their auto insurance or
Liability only. right?
liability
Yeah.
only. And so when it comes to health, they're willing to take a chance and then say, well, you know what, I'm going to just go to the ER
No, Laredo.
or Nuevo Laredo.
Yeah.
What do you recommend for people who don't have health care?
Like for me, I recommend you at least try to get something because you never know. It's better to be safe than sorry, but you have to weigh it.
Yeah. What about clinics like Gateway Health Clinic? I know San Antonio has similar clinics where if you pay according to your ability, right?
Right.
Whatever you make. What about clinics like that? People don't avail themselves of those as much as I think they should. They wind up in
It's
emergency
just
rooms.
that a lot of people. It's about education. There's a lot of different clinics. There's clinics for indigents. Like you have Mercy Clinic, you have Gateway, you have different different options. A lot of times people don't know. And so a lot of times when they come in and then you start looking at their needs and you start seeing their financial situation, sometimes they may need Medicaid. So you may kind of drive them in that direction, right? So
I think you're right. And I know the county at one point years ago were in the red because of their healthcare situation. They opened up a clinic. They strategize a lot about employees coming into that one clinic, and they've been able to educate their employees, and it's driven their healthcare costs down. And so
yeah, and it's also driven by the companies. I mean, for example, one of the corporations I work for, they gave us $500 a year. You could either spend it on your fitness center, or you could buy health equipment, weights, whatever you wanted. So we would take that, and then they'd give gift cards for walking. If you made 10,000 steps in a certain amount of time. So they were benefits because obviously you want to get your people healthy,
Sure.
and then drives down your insurance
there's some motivation.
and motivation.
That's interesting. Good.
All right.
Good for you.
Well, we're going to take a short break. Take a commercial break, and thank our sponsors for their patronage, and we'll be right back. Say, open up the.
Life is full of great moments, special moments, shared with friends, family, and loved ones. But for some, pain deprives us from fully enjoying these moments. If chronic pain is keeping you from fully enjoying life, there is hope. Hi, I'm Dr. Marta Martinez. At Advanced Spine Pain Solutions, we're dedicated to treating our patients with the most advanced and compassionate care possible. Visit us for an evaluation and let our experienced staff help you get back to living a pain-free life. Life is full of great moments, special moments, shared with friends, family, and loved ones. But for some, pain deprives us from fully enjoying these moments. If chronic pain is keeping you from fully enjoying life, there is hope. Hi, I'm Dr. Marta Martinez. At Advanced Spine Pain Solutions, we're dedicated to treating our patients with the most advanced and compassionate care possible. Visit us for an evaluation and let our experienced staff help you get back to living a pain-free life.
And so we're back. Three Men in the Mic with our guest, Pablo Granados from Farmers Insurance Agency here in town. And we had one last question for him, because this is one that kind of fits right in where we are in this particular program. When we have discourse between Joe and Javi and I, where we kind of want to choke each other from time to time. It's when it gets into the political realm. And one of the big questions I have always had is, the Affordable Care Act only impacts about 8%. Joe, what was the numbers?
8%. Yeah.
8%?
Yeah.
So 49%.
49% are by employees, covered by employees. 17% Medicaid, 17% Medicare. Then 8% were uninsured.
Right. And that 8% has caused the Republicans and Democrats to fight to the point that they shut down the government. They fight over control over the House and the Senate on that topic. But yet, it really is only 8%. Granted, in communities like ours, it's probably higher, right?
Yeah.
Albeit, some of it is by choice, because we talked about how they go to Nuevo Laredo, or they choose to go to the emergency room and absorb it that way. But tell me why that has become such a hot topic.
So I think, obviously, with the Affordable Care Act, it put a lot of pressure on corporations to provide insurance for their employees. That was one, right? So then another is, so why it's important for that 8%? That 8% has a lot of people who are in need, and they can't go anywhere else. So I believe it's the optics of, now you're making a big deal about it, yes, but it's also because you're taking people that have pre-existing conditions, right?
Right.
So if they go elsewhere, they're not going to get any coverage. So you have the ability of the government putting kind of pressure on the big corporations to provide insurance, to the employees. In some states, not in Texas, the Medicaid has been expanded, and so in that case, there's on the poverty level, the threshold is a little higher.
The higher.
So then that you do get some subsidies, or you can get Medicaid.
Right.
So here in Texas, since the poverty level is a little lower, or a little more lower than the other states, so they don't have the benefit of the Medicaid. So
Got it.
that's why I think, and I really believe it's the optics,
Yeah.
And with that, one last question: how do we make it better? I mean, if you had the ability to sit on a governmental board, be it council, commissioner's court, state rep, senator, congressman, how do you make it better? What would you pitch that would make it better, having been on that side of the ledger where you're seeing these people come in who can't afford their liability insurance for their car, let alone a premium for health care? How would you fix that?
So I think they need to have better negotiations, in my opinion, with the healthcare companies, right? Because at the end of the day, if you're still, insurance is always going to be looking at risk, right? So if you're bringing in people with pre-existing conditions, obviously your pool or the group of people are going to see the doctor a little more, right? So then there's going to be, it's kind of similar, the way I look at it with auto insurance. You live in one zip code, you get a certain premium, you go live in a different zip code, it's higher. So I believe that there should be better negotiations with the healthcare insurance, and also with like the prescription medication. Like some countries it's lower because it's negotiated with the pharmaceutical companies at a national level, at a country level, versus
That's what I was going to say.
Right.
The pharmaceuticals are really key.
Right.
All these self-insured. You got the county, the city, the school districts. They're all self-insured.
Right.
One of the things that they target a lot is the pharmaceuticals.
Right.
How much they're spending on the pharmaceuticals.
Right.
But I think if we elect more Democrats to the U.S. House,
why
and
did I know
start
that was coming?
pushing the Obamacare and the Affordable Care Act,
Yeah.
you might
I think
get some better results.
I think I read somewhere that the United States, I think per person comes out to like about $13,000 a year that we
In-
spend on
healthcare.
on healthcare.
On just healthcare alone.
On healthcare.
Yeah, and we take advantage.
Which is the most expensive one
well, I mean,
in the world. basically.
And for the longest time, one of the things that the current administration is working on is bringing down those drug prices. That we
Right.
were treated as a kind of a well, those guys can afford it, so let's stick it to the Americans, and they sell us medicines at a much higher rate than you get it in Nuevo Laredo. Same product,
thing.
same company. I mean,
Mounjaro and Ozempic, we're going to have to,
Yeah.
find the generic version of that. So
And the Nuevo Laredo version.
yeah.
no.
Yeah.
Well, I'm glad you came on. I know we
thank you for
could
having
probably
me.
be here another hour talking about healthcare because it's a hot topic. We've said it before. We've said it before that it's just one of those things that every 4 years it makes the rounds.
Oh yeah.
And it has been for forever, even before the Affordable Care Act. They've been fighting on how do they cover, those folks who fall through the cracks that don't get the insurance that they need.
Right.
But we hope that you'll come back to us. We've got another guest coming on soon.
Sure. Yeah.
We're going to take a short break while we bring on our next guest.
Been a pleasure.
Pablo, thank you. And
Well, thank you
and
very
don't
much.
leave.
Thank you
We want you
very
to come
much.
back so you can
Okay.
sit with us and talk about
you
the
can
last
bring the
bite.
next bottle.
Okay.
Yeah, we'll talk about the last bite.
Well,
All right,
thank
we'll
you
be
for
right
having
back.
Okay. All right.
Life is full of great moments, special moments, shared with friends, family, and loved ones. But for some, pain deprives us from fully enjoying these moments. If chronic pain is keeping you from fully enjoying life, there is hope. Hi, I'm Dr. Marta Martinez. At Advanced Spine Pain Solutions, we're dedicated to treating our patients with the most advanced and compassionate care possible. Visit us for an evaluation and let our experienced staff help you get back to living a pain-free life.
Live with Joe, Javi, myself here at Three Men and a Mic, and our guest for the second half of our show, the second half of the healthcare, which is the delivery side of healthcare, Dr. Marta Martinez, a double board certified pain management and anesthesiologist here in Laredo, Texas, and the Valley. And also, you are currently the president of
The Tri-County Medical Society, which is Jim Hogg, Zapata, and Webb County. So
Outstanding. Congratulations on
Thank
that.
you.
I know
Thank
that.
you. County Medical Society. It's pretty exciting.
Very good. Yeah.
Tell us a little bit about yourself, doctor. What?
From McAllen, Texas. Well, first, this is not the body sculpting area, is it? Because I was here for the body sculpting.
No.
I think that may be
That's next door.
That's next door. Because I saw that.
Yeah, we told him he was going to get free body
Yeah, I
sculpting.
was very surprised when I saw this whole setup.
No,
So
this-
it's kind of threw me off a little bit. This is good. I'm from McAllen, Texas. I have 3 little girls and a beautiful wife. I'm happy to serve this community. I also travel down to Edinburgh and I serve that community as well, McAllen, Edinburgh area. So I do interventional pain. Well, actually, I do general pain medicine, so everything from medication management through interventions and then some minor surgeries for back pain. And so I've been in this community 15 years now. I call, proud to call Laredo home. And so I've been involved in a lot of policy changes in the community and then, kind of moved towards doing more policy for medicine as well. And so I'm kind of serving on the state level as well as I'm a committee member for the Membership Experience Committee for the Texas Medical Association. I'm a board member for the Texas Pain Society, and so I try to keep myself active as well. I really enjoy
Very good.
because when we're able to shape or we're able to make decisions and shape patients' lives, we're able to help so many patients. And so I like helping my patients there, but I also like helping patients in general. And so that's what we try to do, protecting access for Texans.
Good.
Very cool. And you're expanding your practice. I saw you're building a building right next door. And
Yeah, continue to grow.
Yeah.
We continue to grow, trying to bring better services, state-of-the-art services to the community. That's what we're trying to do. We really, when I left South Texas, because I did leave to, I went to Dallas and San Antonio, Oklahoma, and I did my schooling up there. I left with the intent of always coming back and serving the South Texas community. It's where I call home. And so my goal for the last 15 years is to bring the best care, the best pain care to all of South Texas. And so that's what I'm going to continue to try to do. So I'm very proud of what we do. I'm very proud of my staff. I'm very proud of our outcomes. And we're going to kind of continue to try to do that.
Good for you. Good for you. Good one.
Well, Doc, the first question out of the gate, and you said you came back to serve the the community. But a lot of communities like ours, especially along the border, and it's not just a Texas thing, it happens in New Mexico, Arizona, California, along the border areas, rural communities throughout Texas as well as other parts, are medically underserved. Why is that? Why are communities like ours medically underserved? Not enough doctors, too many patients, combination thereof?
No. Well, yes. So healthcare is sort of a complex thing, right? So if you talk about just physicians in general, why they don't come to these areas, it's so multifactorial. But let's just start with the simple stuff, right? The simple economics of any business are going to also resonate in medical practices, right? So if you want to have a thriving practice, you need to have the right payer mix, right? The right payer mix is tied to median income, right? So median income is what's going to allow people to be able to afford those insurances that are going to attract those specialists. If you don't have that median income, and it doesn't matter what business you are, you're probably not going to thrive in a community like Laredo. You add to that administrative burden in communities like this, coefficient factor, we get paid less in this community than in other areas because there's a geographic coefficient index. And then you have a high burden of disease as well in the community, right? So you have a very high incidence of diabetes, a high incidence of high blood pressure, and you remember that it's those particular patients that are a lot more acute, they have higher acuity, they are a lot more taxing for physicians, right? And then you need to have the proper infrastructure, right? So if you need a specific examination in a community like this and you have to send them off to San Antonio because, again, economics of medicine don't allow the viability of people through the door to have a sitting MRI or sedation during an MRI or, specific cancer treatments because we just don't have enough people in the area. Well, we can't sustain those things. And so medical specialists and primary care doctors want to serve a community like Laredo, but it's very hard. And so the environment in a local community has to be to strive to make that economic investment in physicians to make it work. And so it's very multifactorial.
So one of the areas is childcare, kids with special needs, or just special needs, right? So how do we get those people here? How do we get these doctors here?
Well, again, you got to go back and say, how do I create an economy that's going to grow enough to then be able to have enough people in it to be able to drive the market in this direction, right? So I've sat in meetings with hospitals and hospital administrators, and they're very clear, right? They want to serve the community, but they're also dollars and cents, right? They're businesses. That's the way it is. And so if you look at child cancer or whatever it may be, we want those specialists here. But if there's a limited number of patients that they treat, then the viability of that practice goes down. And now they're supplementing the income of those physicians to stay here. The other thing is socially, right? In a place like Laredo, I love this community, but I grew up in a South Texas community. And so I like ranching, I like hunting, I like fishing, I like those things, but not everybody's like that, right? Yeah. Some people chase the urban dream, right? They want to live outside of San Antonio. They want that big city feel. They want things to do, and especially spousal support for those things. Right. And so, again, there are so many things that go into having a viable practice and having specialists and physicians. Another thing is training programs. Most physicians stay within a 60-mile radius or 90-mile radius of wherever they train, right? That's what they do, right? So now that we have internal medicine and family practice residencies here, we're starting to see a climb in some of the family practice doctors and internal medicine hospitalists that we have in our community. We didn't have that before. But we don't have that same anesthesia, general surgery, orthopedic surgery, neurosurgery, pediatrics. We don't have any of those things. And so they're going to stay in the areas that they train because that's where they make their connections. That's where they interview, close to San Antonio, close to these urban towns. And so it has to be a concerted community-wide effort to try to make this happen. I tried to kind of work on that a little bit by creating a hospital district for the city and seeing if we could work to bring in physicians and incentivize physicians to come into the area. But hospitals have thrown thousands and thousands of dollars at this problem, and it's been difficult. Even private equity has tried to throw money at this problem as well here locally, but the numbers are the same, right? If you don't have a proper payer mix where you have commercial insurances that are able to drive your profit higher, then it's not going to work. Because again, being a sick community, we suck resources out of the system, and not having median income means we don't put a lot of dollars into the system. And so communities like South Texas, and people that come across from Mexico that also come and use our services as well. Not many, but they do. They add to it as well. So again, why do we have this problem? It's multifactorial. And in order to fix the healthcare system, you need to start fixing Laredo first and making it an attractive place that's economically viable, and then everything else follows. It's chicken and the egg.
So both our hospitals are for profit, correct?
And then some.
And then some, right? So then we have San Antonio that has some hospitals that are not, right? I mean, they're all, you know what I mean? Like, so starting a hospital like that here would I think the city's trying to push a hospital.
The county, I think, is the one
county
that's allowed to
county,
do it. Yeah,
right?
the county.
The county has the ability to actually create a true hospital district, right?
A taxing entity.
Right? But we're already pretty maxed out in our community as far as taxes are concerned. And if you bring up that that three little word, taxes or tax, you're going to get into trouble in this community because nobody wants to.
Sure.
As it is, when you talk about healthcare and the expense that healthcare is, honestly, everything's more expensive these days, and people are making really tough choices right there.
Sure.
Groceries, gas, or healthcare. That's the reality in which we're living in, especially in a community like this.
Does that, and I hate to ask the question because I battle with that too in my profession, but does that affect quality of healthcare? How do we battle, or how do we change that mentality that we need to go to San Antonio or we need to go to Houston
Right.
to get the quality of healthcare? And it's the same in my profession. I need to hire somebody from San Antonio or somebody from out of town to come and battle. And I think we have just as good lawyers, and in the legal profession is just as
we
good
had one here the other day.
as it is anywhere else. Does the quality ever suffer because of that the lack of that median income?
Yes, and so the short answer is, why do people? I mean, if you're asking why people have to go to San Antonio,
Why do they? I mean, why do they make that comment that I don't want to see a doctor in Laredo. I want to see doctors in San Antonio or Houston or wherever.
Again, so many reasons, but one is sometimes they do, like just plain and simple, they do. If there's a specialist, if you're looking for a specific cancer specialist that focuses on one particular type of cancer, they're not here because we don't have the per capita person or people walking through the door to do that. So you're going to go to those metro centers, and it doesn't matter if you're near Houston, near San Antonio, near Austin. You're going to go to those metro centers where there are more patients like that, right? Services also, right?
Yeah.
If you don't have the proper services, you do have to go to San Antonio to provide those services from an economic perspective. But there are incredible physicians in this community, right? And sometimes there's the saying, right? No man is a prophet in their own community, right? Like if you went to high school with your buddy, and your buddy's a heck of a physician, but you remember this guy from your drinking days, and you're like, come on, man, I'm gonna go see someone else, But the truth of the matter is that may be a subject matter expert in whatever they do, right? And so they're great physicians in this community. But there is a perception that larger cities has to equal better care. And that's not necessarily true. Oftentimes when we're here, we battle on our own because we have limited resources, and we have very sick patients, and we have very limited resources. And so now we have to become very resourceful ourselves to try to mitigate costs because patients can't afford it. So what can we do to mitigate the cost for the patient? Because I have, many times said, hey, I need an MRI. And they're like, doc, I can't get an MRI. What can you do for me? All right, well, let's start with an X-ray. Let's do this, let's do that, and we kind of work with that. And so to answer your question, yes, it definitely affects care locally, without a doubt.
But Doc, you said something in the pre-show when we were talking before you came on, and you mentioned that. And I love that quote that it's hard to be a prophet in your hometown. But this is not unique to Laredo, is it? I mean, when you said, ask somebody in San Antonio, and I did, and Sure enough, they said, well, I see doctors in Houston, or I see doctors in Austin. And is it because in those circles, I have an experience with a doctor that's not positive, and I share it with Joe, and then Joe's cousin says, oh yeah, I know that doctor I had, and pretty soon there's this perception that particular doctor or the doctors in that field are not good doctors, and therefore I need to go to San Antonio Corpus. But it happens over there as well, correct? I mean, you're around those doctors all the time.
Yeah, definitely. And also marketing has a lot to do with it, whether you believe it or not. Very large healthcare systems use significant marketing strategies to local communities, online and all, and throughout the places, because they're really trying to attract people. Again, it shouldn't necessarily be, but it is the business of medicine, unfortunately. And for these places, they're trying to attract patients, and so we give the best quality care, cancer treatment, and in Houston and MD Anderson, and so they create these marketing strategies, and when they hit, they become the mecca for that, right? And so we don't quite do that locally. We're out here. Being a local physician, I can tell you that we're boots on the ground, right? And a lot of times what you see is these things, these issues that you guys are bringing up, they're fought nationally, but they're really local issues, like in all politics, right? And so we have to deal with the consequences of what's happening everywhere, right? Including some of these big metro areas. We're the little guys compared to those big behemoths, right? And so these big decisions are made because of these big behemoths, and then we take on the administrative burden. And we can't afford what these guys do. Like, we just can't.
Can a practice get too big? And by that I mean this, right? So, family member has been going to this one doctor, great doctor, I love the doctor, but every time we go, we don't see the doctor anymore. It's a nurse practitioner. Mm-hmm. So every time, we don't have that relationship with that doctor anymore. Right, because this doctor sees it, and all of a sudden, what he saw a month ago with my family members, now you have to explain it all over again to another doctor, right? So you go to this doctor, and you have an appointment at 9 o'clock in the morning, and you don't see him till 2 o'clock in the afternoon, right? So those are some of the reasons that people say, I go to San Antonio, they see me at 11 when my appointment's at 11.
So 2 things here. One, I think advanced practice providers definitely play a role in extension of physicians, okay? Whether it's a physician assistant, whether it's a nurse practitioner, I think as long as, it's a physician-led team, I think that it's a very viable system for rural communities and for many communities. I will say that it has to be physician-led because, again, the economics of medicine tell you that all nurse practitioners, all PAs, or a good portion of them continue to go into urban areas. So independent practice for them doesn't really work, right? But I will tell you that, yes, you do see more patients here. One, and it's really, really important, okay? The coefficient thing, right? So if I see 10 patients here and somebody sees 10 patients in San Antonio or 10 patients in Houston, they make 30% more than we do here. Okay, so just to be clear, okay, we have to see a third more patients, if you will, in order to get the same amount. Second,
and why is that?
Geographic coefficient. So Medicare ties the geographic coefficient to your location.
What you were saying.
To your location, right? And so, and then they have us in Laredo tied to the valley, where the median income is low. Where the cost of living is low, but our cost of living is in line with San Antonio, right? And so our cost of living is much higher here than in other communities with lower median incomes, and so we're kind of stuck in the middle. We get paid less, but our cost of living is higher. So that's one thing. 2, a lot of people don't travel. They don't like to travel outside the city, right? And so here, like I take walk-ins, okay? So I'll schedule 35, 40 patients, okay? Patients that are in pain, they know they're going to go see Marte and they're going to go get treatment that day. And so I'll have 15 walk-ins, right? And so even if I want to schedule less patients, they're in pain. And a patient that's in pain, or a patient that has chest pain, or a patient that is scared about a new bump that just came out, they're not going to wait, right? And that's the sacrifice we make here locally, right? Because everybody knows me. I'll get text messages from friends. Hey, you don't have an appointment for a month and a half. Can you see my compadre tomorrow? Yes, I can see your compadre tomorrow.
Interesting comment that came in off of YouTube from at Holland_Gina. To Joe's point, which makes people shy away from seeking care in Laredo because of the experience, like you said, where they don't get to see the doctor. After a while, they're seeing a nurse practitioner, even though they're getting good care.
Oh, yeah.
But they invariably decide, I want to see a doctor in San Antonio, and because the patient load is less, they get paid more, so they can take on less patients and still make relatively good money.
And it's not just Medicare. Remember that they're getting commercial insurances at a much higher rate
as well.
Yeah, all right. So this community has a lot of Medicaid community, a lot of a lot of self-paid, and then we also have a lot of Advantage plans here. These other practices, if you have, because you have to be very careful in how you have to compare apples to apples, right? So we're taking on very sick patients with low median incomes, with a lot of with lower insurances, if you will, right? Versus you go to San Antonio, let's say you have the means to go to San Antonio for an appointment because you have a Blue Cross Blue Shield insurance, which is a PPO, and it's the creme de creme, or you have an Aetna, or you have a Humana, or whatever it may be. Well, yeah, you're going to go to a physician over there that only sees 20 patients or 25 patients because they have the payer mix that sustains the viability of a practice. Here, very sick patients, very low remuneration, and so those patients that come in, those Blue Crosses, those insurances that want to be seen quickly, which I wish we could do that for everybody, they're going to go to San Antonio and have a much more pleasurable experience because of those variables that I'm telling you.
Wow.
Well, and again, a question that came out there on one side was, why wouldn't hospital physician surgeons be enticed to work in Laredo at Jeremiah B320? Well, I mean, Doc, what brought you to Laredo? I mean,
the job opportunity and the mentorship. There was a physician here, Dr. Jaime Sued, who has, I think he has a practice now in Mission, but Dr. Sued at the time, he was seeing patients here. Yeah. Really good doctor, did really well with his patients, good business mind, knew how to run a practice. I interviewed in San Antonio, I interviewed in a lot of different places, but at the end of the day, I just felt like he was going to be a good mentor for me, and he was. And so a couple years later, he sold me his practice, he moved back to the Dominican Republic, and then he came back several years afterwards. Right. And so I came here because of a job opportunity. I stayed here because of the people. People of Laredo are community at its finest. They're good, honest people. They are very respectful, very hardworking, and they're good, honest, salt of the earth people. And so I fell in love with the patients here, and so that's why I stayed. And also, we're from South Texas, and so it's easier for us to be able to, again, I love the monte. I like to be on the monte. Not everybody's like that, right? Yeah. So if you like to, if you like a bunch of art or, art walks.
What about the knock? I mean, that's the big knock on Laredo. There's nothing to do. So, yeah, the doctor's going to spend his time inside his four walls at his clinic or at the hospital. But the wife and the children, what do they do? I mean, there's nothing for them to do in Laredo. And I put that in quotation marks in air quotes because I've lived here all my life. I lived in Houston for a while, lived in Austin for a while, and then came back to Laredo. And I found Laredo to have plenty to do. Laredo Theater Guild International puts on phenomenal plays. Laredo Philharmonic has great concerts every year. There's a planetarium. There are some museums now. We're starting to kind of develop the art scene in Laredo. But there's also other things, beyond that are here. Great restaurants, great people, two higher education schools here, TAMU and LC, both of them with exceptional nursing programs, top in the nation, as Jeremiah B320 had said on YouTube here, one of the comments that came in. So again, why is it so hard to attract these doctors that are not like Martinez, who is from South Texas, and South Texas is in his blood, so to speak?
You have to work harder. You have to work harder in a community like this. You have sicker patients. You don't have the support. You don't have the right payer mix, and you don't have the spousal support. And that's one of the things that I'm working on from the County Medical Society portion, is we're trying to create a spousal network, right? It's called the TMA Alliance, which is a way of combining spouses to do community events, and so that when a physician comes into the community, he or she their spouse starts being able to be involved and welcomed right away, so that they feel like they have people to talk to. That's something that my wife and I are starting to work on. It's called the TMA Alliance. It exists throughout Texas. We don't have anything locally, and so we're trying to do that. And actually, they used to do that before, many years ago, 25, 30 years ago, but it went away. And so we're trying to bring it back, because we think that if we can increase spousal support and get the physician focused on patients, not on, my husband doesn't like it here or my wife doesn't like it here, they don't have enough to do. And also good schools. Good schools are important, right? So every time I've interviewed somebody, it's always been the same question. What are your scores like? Where are the good schools? Where do we go? And so that's one of the most important questions that we get asked all the time.
Let me ask you to forecast a bit, Doctor. Where do you see Laredo, Webb County's healthcare in the next 5 years, 10 years? How do you see us, do you see us progressing? I know that there's been talk of, somebody turned dirt not long ago on the new hospital.
Micro hospital.
On a micro hospital. We have all these standalone clinics coming up. What do you see in the future for Laredo?
Okay, so let's talk, if I may, let me just talk globally for a second, okay? Because again, national is really local, right? So I think the focus has shifted over the last 10 years and will continue to shift, 15 to 10 years, and will continue to shift towards quality care as opposed to quantity care, right? And so as we're able to improve quality, we'll be able to drive prices down. But quality starts early, right? And what I mean by that is, if we're able to get people to be seen and to be healthy before they get sick, that's how we drive costs down, right? And from a local community, being a former policymaker, I can tell you that walkability is very important, right? Sports are very important. Investing in our youth to keep them healthy is very important. Preventative care is very important, right? So if the community invests very heavily in having youth sports, in having walking programs, in having senior citizen programs, in having shade, and having walkability, a lot of these other countries have these things, right? So if you want to know the health of Laredo in 5 years or 10 years, how much did we invest in those things? How much did we invest in preventative measures? How much did we invest in people exercising and proper nutrition and less processed foods? When are we going to go after those dyes? When are we going to go after those processed foods? When are we going to go after those glutens? When are we going to go after the alcohol? When are we going to go after cigarettes? When are we going to go after those things, right? So if we're able to go after those things, I think the healthcare of Laredo is going to continue to grow. Now, economically speaking, I think we're growing. If we continue to diversify our economy, I think we stand a good chance, a very good chance of having more marketability for Laredo. But it is going to take basically an infusion of investment in health, an infusion investment in different economies for our community, and also preventative medicine in our economy.
Education.
Education as well.
Sure.
Yeah, and
Good comment coming from Jesus Ramirez, that he agrees that to make Laredo more attractive. I mean, we've done that. I as a council member, and you council member, when you came behind me, and we kept adding to North Central Park, and that park concept has taken off. Now you have Bartlett, you have Independence Hills, and all these others that are coming.
and you see them busy.
And you see them busy.
You see them
More
busy.
so than you do the rec centers, right? Which you would think, because Laredo's so hot, that the rec centers would have all the traffic, but it really is bang for buck, better in the open spaces than it has been at the rec centers. The pickleball courts that you kind of laid the foundation for by doing that nice canvas at Divine Mercy now has
And they're
pickleball.
amazing.
And they're amazing. They're
Hats
full.
off to Dr. King for that.
Yeah,
They're
Dr. King
amazing.
did an excellent job there with,
Yeah.
with those courts. But how do we get that on our presentation to folks when they're coming here? In other words, there's got to be, and maybe this alliance that you're talking about, where we get to introduce them to people in the community and show them, hey, there really is a lot to do. But there's a lot to do that you can contribute to make this your city as much as it is ours, as we bring these people in.
Last year, when I became president of the County Medical Society, one of the first things I did is I created the resident welcoming meeting, basically. So it was basically a wine and cheese and hors d'oeuvre for the incoming residents. So all the residents were able to attend. And I brought in some political leaders. I invited some people to come in and speak to welcome them. And so that was a huge success. That was a huge success. But I think we need to do that not just for the residents, but for any physician that's
Right.
brought into the community, right? We, whether it's a chamber, whether it's a Hispanic chamber, whether whoever it may be, needs to take it upon themselves to make those new physicians in the community feel important, needed, respected, and truly as part of the community. Because when you feel as part of the community, like I mean, again, my patients made me feel like part of the community. If patients or people around the community make those physicians feel at home, and feel their spouses feel at home and their kids feel at home, all of a sudden we're able to build something, right? It doesn't mean that, you know, that everybody isn't important, right? We need to have engineers here. We need to have all people here. But investing in healthcare, because we always talk about the cost of healthcare, but what you need to realize it's an economic boom. Healthcare is a big investment that we make. A safe community is important, but a healthy community is important too,
Yeah,
right?
Right.
Right. So equally important, right? So if you have a healthy community, you have a healthy workforce, you increase productivity, you decrease sick days, and you have more productivity. And then on top of that, you decrease burden for employers, you decrease burden for pools, you lower rates. And so all these things are really important. And remember, $1 spent in healthcare goes around 1,000,000 times, right? So you talk about hospitals are one of the biggest employers in the community, right? Nurses, they're highly skilled. You know, physical therapists, highly skilled. Respiratory therapists, highly skilled. CRNAs, highly skilled. These cost money, right? But if we can get these services here, the sky's the limit to what we can do for our patients. You know, so
Agreed.
that's how we do it, Gene.
Gonna need to hook you up with the Laredo newcomers. You know, they have kind of floundered a little bit, not because they're not active, but because, you know, they struggle to put together. Their committee needs funding to be able to put some of these mixers and some of these things on. It'd be great if I could, you know, work with the Alliance to hook them up with the Laredo newcomers. We manage their website. In fact, I've been promising them I was going to do something good for them. That's something that we do because they're a nonprofit. But that'd be great. That way they can participate in this welcoming committee and educating those doctors and nurses that are coming to Laredo as to why this is a great community for them to be here. So.
Which I love this community. It is to me, it's the best community, really.
Yeah.
And I think if we were able to present it in a good way, in a positive way, I think people would stay here. They would follow.
agree,
Like they
sure.
drink the water.
Yeah.
They drink the
They
water.
drink the
I think Jesus Ramirez here would be a good addition to your school district. You know, wants a leadership role in education that involved advocacy for visual arts. I mean, man, right up our alley here. With all
And that's
us.
one of the things that we at the school district level struggle with. You know, we've increased our substitute budget from, you know, $2-3 million to $9-10 million now. And, you know, we encourage our employees to stay healthy. We encourage them to, you know, preventative care, trying to get them back into the workplace so we can reduce that substitute budget, you know, and get it back down to where it was. But, you know, that's one thing like you just mentioned.
I'm going to tell you something. This is something that I shared with a council member before, because I think it's funny, and I don't know if my staff is going to like me saying this, but I'm going to say it nonetheless. So I went so far as to pay for the gym membership for my staff as part of their employee package, right? So I shared the burden with them, like 50%, right? So I got them all on as a local gym, okay? And on top of that, I told them, okay, that if you go to the gym for an hour, I will count that hour as work and I will pay you the hour, okay?
Oh, wow.
Right, so that's what I
very
told
cool.
them. Okay, so if you document that you go for an hour, I will pay you the hour as work. Okay, we did this for about a year. So just like January 1st, right, when everybody goes to the gym, it lasted about 2 to 3 weeks. Right, so 2 to 3 weeks, the gym was busy with my employees, and then one stuck it out. Everybody else kind of left. Some other I have two that are very, very healthy. But they go to their own gym. They didn't want to have anything to do with it. But they're, you know, they compete. They compete, all that. But the rest of them, they just didn't go. So I'm paying them to go, right? And not only am I paying them to go, but I'm paying for half their membership, and they still don't go, right? So changing the mentality and the culture, you know, the culture of food, the culture of celebration, the culture of those things, the culture of the fast food and the greasy food and the tamales and all that stuff, the good stuff. That's very difficult to do. You know? That's very difficult.
It's a cultural.
Yeah, it is. And so keeping people healthy is to your point, is very difficult. No matter how much money you throw at it, that's not going to work. You know, it's not a money thing, right? It's you have to change the mindset, and a lot of times it comes from activities. Like, I like to jog, but somebody else may like pickleball. Somebody else may like basketball. Sure. Yeah. Somebody else might like swimming. And so having variety in your community so that everybody gets to do something. Golf, whatever it is, right? Something. But we have to change the mindset, and I think that. That's something that happens with younger generations. It doesn't mean that we can't change, because we can change, right? Rocky Balboa said, if you can change, we can change. Everybody just changed.
Dated all of us. Watch that movie.
But nonetheless,
true as it is.
It's true, and sometimes you don't realize it until. I say it jokingly, but people ask me now, hey, Javier, I'm going to see you next week at this event. God willing. Si Dios quiere. I'll see you there. Why do you say that? Why do you say that? Because I'm at that age now where just people all around me are starting to either get sick or pass away. You know, heart attacks, the
cancers, the
strokes, cancers, diabetes. And so it's a realization that we need to start taking care of ourselves. And, you know, the different groups that I frequent and hang around with, we all agree, like, hey, let's start off the year with a health check, you know, and everybody starts there, you know, down that road. But yeah, you know, you're right. The cultural, the menudos, the barbacoas, the tortillas de harina, and the tacos, and that kind of that's always plays a role in.
Because we always call it the good stuff, but it's really the bad stuff.
Yeah, you know,
it's really
we're just Cokes alone and breads and you know.
Well, it's a good segue. And we touch on the culture of food, and the last segment of our show is called The Last Bite. So we're going to take a quick break, and we'll bring Baldo Granados back in here, and we'll talk about The Last Bite. All right. Okay, we'll be right back.
Life is full of great moments, special moments, shared with friends, family, and loved ones. But for some, pain deprives us from fully enjoying these moments. If chronic pain is keeping you from fully enjoying life, there is hope. Hi, I'm Dr. Marta Martinez. At Advanced Spine Pain Solutions, we're dedicated to treating our patients with the most advanced and compassionate care possible. Visit us for an evaluation and let our experienced staff help you get back to living a pain-free life.
Joe, we have our last segment, which we call affectionately the Last Bite, started by our good friend Henry called in on one of the shows and asked which side of the foil goes in when you're baking a baked potato, the shiny side in or shiny side out. And of course, that led to discussions about food. We all left hungry, all went to eat somewhere. And every show since then, we talk about food as the last bite. So Joe, I'll let you have the last bite. What's seafood? What's the best seafood place in town, especially since we're in the Lenten season? Lenten options?
Honestly, I like La Roca, but I can fry a mean fish.
You can fry your own
Oh,
mean
yeah.
fish.
Oh, yeah.
Absolutely.
Oh yeah.
So I went this past week on Friday. I went to this truck, the food truck
Uh-huh.
here on Fenwick and McPherson called L.A. Bistro.
Louis.
Oh, yeah.
And,
Louis Bernie.
Louis.
And estaba, the guy that was there was Frank, and they had a tuna burger. Excellent. All the food there was excellent. I've been there like twice since. They have the shrimp tacos, they have ribeye tacos, but it had the best tuna burger that I've tasted in quite some time. And so, people that I've talked to always brag about that place. It's usually pretty packed, and they have really good service. And you can go and sit outside and under the lights and enjoy it. But I had a really good experience there. So.
Doc?
Best seafood in town?
Anywhere. I mean, just if it's out of town, in town. I mean, this show is watched all the way into Utah and Georgia and Canada. We've had a couple folks call in from other places.
Oh
So,
my goodness.
best seafood you've ever had?
Wow. Best seafood I've ever had in my life? There's
King's
a little.
Inn or something.
Well, I don't know if we can still find it, but there was a little place outside of Matamoros on the way to Playa Bagdad that they kind of shucked. They shucked your oysters
Oysters,
there, and they did all that right away. But another place for oysters, I like oysters, Acme. Acme in New Orleans.
In New Orleans?
New
Yeah.
Orleans.
Yeah.
That place is phenomenal. Their oyster po' boy is probably one of the best, and
Nice.
so
That's the place, huh?
That's the place. Those two places, because I like oysters.
Pablo?
I went to Tavernia recently. I
Yeah,
had
yeah.
paella,
Yeah.
and it had the seafood. So
Yeah.
I liked it. It was
You liked
really
it?
good. Yeah.
You lived in Austin, so best place from here to Austin.
Oh gosh. Well, I mean, like I would just go to Papados. I mean, I like.
Yeah, Papa's. Oh, it's a good
Papados.
chain, but they make
But they had
really
good food.
good food. Yeah, I
Yeah.
like their pontchartrain sauce on it. I like the
Uh-huh.
red snappers.
There's nothing like oysters on a half shell, man.
Oh.
The doctor
All
was
of
talking
them.
about
Yeah, those are the best.
Yeah, it's
Those are really
I
good.
can't remember the restaurant, Doc, in New Orleans, but they served a pompano and papillo, basically fish in a bag. And they baked this thing with all sorts of veggies inside. It is just absolutely phenomenal. Laredo, Mariscos?
Snoopy's.
Oh, Snoopy's, yeah. Snoopy's
no,
at Padre
great.
Island. I've
Yeah,
gone
good
there
stuff.
quite a bit. That's a great place. Thank you,
Gina.
at Holland Gina. Thank you for that. We do. We go. Beto Trevino's favorite place is Snoopy's on the island. Of course, he's got a place out there on Puerto Aransas. But here, Mariscos Pacifico, just around the corner
Oh
here.
yeah, very good.
That's
food.
got a great.
Very-
and it's
never been
well
there.
served. They have a molcajete they bring to you. It's
Yeah.
really, really good. But
Very good food.
yeah,
I'm
that's the
starving.
best place. Yeah, now we're starting. See,
That was
and
starving.
this is what the last segment does to us. The last bite leaves us all hungry. And so, well, Doc, thank you so much for coming. We
Thank you for
appreciate you
having me.
being
Thank
here
you,
and,
Doc.
Appreciate
and
your time, guys. Appreciate
covering
it.
that subject. Baldo, thank you so much on the insurance. Informative. I held a health and general lines license for about 6 years,
Okay.
and finally decided that was enough. I didn't want to do that anymore. But my son Josh worked for Cardinal Health, and
Right.
so to us, for all of us here, I mean, we've all had health experiences, with both on the delivery and finance side, the
Right.
things we see, and we consider this a hot topic that we'll probably come back and visit at some point. But again, thank you, Joe, Javi, Gene, for joining us tonight. We appreciate everybody who joined in and made comments. This is our first live show. We still have some kinks to work out, but we're getting better and better at it. And our next topic is life after death.
Nice.
Is there
interesting.
life after death? So
That's an
if you've got some questions about life after death and near-death experiences you want to share, go to our YouTube channel, our Facebook, social media platforms. drop your questions and your topics there, and we'll be happy to share them with the rest of the community as we have our show. So thank you on behalf of the Three Men and a Mic crew. Have a good night. We'll see you soon.
Good night.
Good night.
Enjoy your
everyone.
week. Happy spring break.